Well, today marks the World Patient Safety Day as declared by the United Nations. The UN is calling for global solidarity and concerted action by all countries and international partners to improve the safety of patients. The day brings together patients, families, caregivers, communities, health workers, healthcare leaders, and policymakers to show their commitment to patient safety. This year's theme of the World Patient Safety Day is Safe Care for Every Newborn and Every Child. And joining us for this conversation is VP Medical Initiative for Africa, Dr. Agbo Ibuta, who joins us to talk about the World Patient Safety Day. Good to have you join us at this time. Talk to us about the significance of the World Patient Safety Day.
Yes, basically, patient safety is critical because patients, as they access healthcare in the healthcare facility, they are exposed to certain types of hazard. These hazards can lead to permanent damage of their physiology or even death. And millions of people are affected. And in particular, if we were to dive deeper, when people walk into the hospital, they have either an emergency or on outpatient basis, they interact with doctors. Mistakes can be made in diagnosis, and this can impact patient health. They go to the laboratory to run tests. There can be mistakes during the process of those tests being run. And when you even make diagnoses, and if these diagnoses are wrong intervention or treatment can be administered. All of this can have negative impact on patients. And in particular, within the subsets of the patient populations are children who are more impacted. That's why the theme for this year is patient safety from the start, with emphasis on children and in newborn and in children under 9, because these patients, this group of patients can have catastrophic impact of medication errors, hospital-acquired infections, wrong diagnosis, and all those risks and harm that come from suboptimal healthcare.
Let's talk about how much of a concern this is. A WHO recent report says about 1 million newborns die each year in Africa generally, many of them from preventable causes. In settings like Africa, where we have, so to speak, limited resources, what training, equipment, or funding models would you advise to ensure that we improve safety around childbirth and newborn care, at least for the first 24 hours?
Well, it starts initially with your systematic approach to the healthcare system. So funding is a challenge. Most African countries, except 2 or 3, are funding their healthcare sector more than 5% of their GDP. So consistently, we must increase the budget to the Abuja Declaration target, which is about 15%. And then recently, of course, the Minister of Health has said that in a discourse, they have discussed the possibility of driving it up. So we must increase funding for health. The second thing we need to do is to look at the human health force, the health workforce. The health workforce is experiencing a significant degradation, and the numbers are being recalibrated down due to phenomena like Japa syndrome. So we need to work assiduously and to strengthen the interventions of increasing the number of workforce we have across. This cuts across doctors to nurses to community health extension workers, because the ratio of a healthcare provider to the patient will reduce things like burnout, fatigue, and allow healthcare workers to provide optimal care for the optimal period of time in a day, reduce their chances of medication errors, practice errors that can have significant impact. So we need to look at health workforce. We also need to look at medication issues around medication dispensing, sourcing, and safety. We do know that up to 70% of some of the drugs in certain areas in our region are substandard medications and are outright dangerous to the health. Either they are not efficacious, so you will be giving it to patients and patients do not get better, or they are outrightly toxic. And when you give it to patients, patients develop some harmful outcomes. So we need to strengthen that significantly. Again, we have seen that there has been some unbundling in the pharmaceutical sector with increase in the number of companies that have come on board. That has to be strengthened. That has to be expanded. We need to stop producing and shipping 70% of our drugs from outside this country. In addition to that, we need to look at the infrastructure. WHO recommends that you should be within 30 minutes to 5 kilometers of a primary healthcare center that has the capacity to provide the intervention that you need, basic diagnostic intervention and early referral to facilities that you need. So in strengthening and reducing patient safety issues.
Let's talk about taking responsibility here. Families, civil societies, caregivers of this patient, how they can be made responsible to speak up, monitor, and also demand, safety for every child and every patient, especially as the trust system, especially in the healthcare, is still low.
Well, it would come with increasing awareness, direct training, and discussions like this, like we're having right now on the TVC News, talking about the issues so that people are more aware. That's the first thing. The second thing we need to do is that we have hundreds of thousands of health facility outlets, from primary health centers to tertiary health centers to pharmaceutical outlets. All of these are platforms and frameworks for us to provide information to the teeming public. 70% of our 70% of healthy or people who want healthcare go to the community pharmacies, or seek healthcare from unorthodox outlets. So we need to find a way of bridging the gap, bringing all of these on the same framework, and then training people actively, providing information so that we share it. The telecom industry has a significant role to play. We have over 200 million lines in this country.
There are a lot of stakeholders in ensuring, patient safety, basically the healthcare sector itself. Everyone has a role to play in ensuring this. But thank you for talking to us at this time. Vice President, Medical Initiative for Africa, Dr. Agbo Ebuja. Thank you for joining us.
You're welcome. Thank you.